Hello and welcome to the OSTEOARTHRITIS YouTube channel. Today for our elbow series we are going to be looking at how to help osteoarthritis of the elbow joint. There's different causes of osteoarthritis of the elbow. A typical hinge joint relies massively on muscular support and ligamentous support for stability. So osteoarthritis can occur due to either post-trauma, so any injury to the area affecting the congruency and movement of the joint, leading to osteophyte formation and rigidity, or can be due to repetitive abnormal loading. So anybody with jobs where you're heavy lifting or holding the elbow in a fixed position, for example desk workers, can predispose or slightly increase the risk of wear and tear forming into the elbow. Our top tips to help with elbow osteoarthritis: number one, making sure we have got the best range of motion through the elbow. So where it is a hinge joint, the main vectors of motion are extension and flexion. So what we recommend, particularly if you are using your elbow a lot during the day, so office workers, is adding in regular movement into the elbow. So nice, slow and controlled, about approximately 5 to 10 reps of flexion and extension, and then adding in that additional movement if we're thinking of the radius and the ulnar involvement, so down into the forearm. Also looking at that pronation and supination. So you can either have your arm at 90 degrees turning, or you can rotate from this position. So gently moving nice and slow and controlled into that pronation and that supination motion. Number two, we want to look at stretching any tightness that may form around the elbow. So if we're looking primarily at the extensors, so the muscles that are responsible for turning outwards and extending, if we want to stretch through, we want to move into the opposite way. So we're going to stretch the extensors first, so on that outer aspect of the elbow. What we're going to do is turn the hand down, hold around the wrist, and then stretching out the arm in front. So you want to hold this for approximately 15 to 30 seconds, and you should feel the stretch down through here. We then want to target through the flexors, so and the pronators, responsible for turning it in and down. So same as the extensors, we're going to go in the opposite direction. So you want to turn the hand upwards, holding around the wrist, and then we're going to stretch it out in front. So our aim is to hold this between 15 to 30 seconds, feeling a lovely stretch on the inner side of the elbow. We also want to stretch through the biceps and the triceps, where they're attaching around the elbow. So to stretch through the triceps, what we want to do is bend at the elbow, holding underneath, and then bringing the arm back. So we should feel the stretch down through here, holding in that position, aiming to hold between 15 to 30 seconds. So feeling a really nice stretch around the elbow. Next, we want to stretch through the bicep. So I always like using the fridge, but anything sturdy that you can hold again. So you're going to have the arm straight, keeping it there, hand against something that doesn't move. And then we're going to turn the head away and move the body away. So you should feel the stretch right down the arm, obviously into the pectorals, so into the chest as well. Aiming to hold between 15 to 30 seconds. Next, we want to add strengthening to the extensors and the flexors, as well as the supinators and the pronators, to add stability around the elbow. So I always use a TheraBand to help with the strengthening. So we've linked the TheraBand around my hand, and what I'm going to do is turn my hand outwards, holding for 2 to 5 seconds, and then back towards midline. So here we are strengthening the supinators and the extensor groups. Holding for 2 to 5 seconds and then relaxing. Aiming between 10 to 15 reps. Next, we want to have a look at strengthening through the pronators and the flexors. So this can actually be quite challenging to strengthen and target this group with a TheraBand. So there's a very specific way of doing it. So we want to grip into the hand, TheraBand coming underneath, and then pulling as tight as you can with the opposite hand. And then what we're going to do is turn the hand downwards. So we're turning it down towards the floor, holding for 2 to 5 seconds on end range, and then relaxing, aiming between 10 to 15 reps of this movement, strengthening the inner part of the elbow.